Good evening, everyone. I hope this finds you well. I was just waiting for a few more people that are coming on live because I know there was a few more coming in that had messaged me because they were struggling to register. So I will just kind of waffle a little while we wait for those to join us. I know some people are watching this on replay as well, which is fabulous. But it's always nice if you can be here live. One, it doesn't feel like I'm talking to myself, and two, it means that we can be a little bit more interactive and kind of take a little bit more from it as well. So thank you to those of you that are joining me live. Hopefully you can hear me okay. It's a little bit loud in my clinic with the road outside, so I will do my best to obviously, if there's any sirens or anything that go past, then it will obviously, I'll just go quiet for a minute while we wait for that. So this evening we are talking about acne. In particular, we're going to be having a chat about follicular acne and the differences between, what we should be treating, what we can be treating, what we can't be treating, and obviously, as always, acting within our competency and confidence levels as well. So we're going to be discussing the types of treatments that you can consider, a few case studies of mine that I've done, things that have worked, things that haven't. And you just get you kind of thinking outside the box when it comes to marketing a treatment like acne treatments, what people will be searching for, what people will be looking for in terms of on social media and treatments and solutions to their problem and skin concern. So if you are watching this evening and enjoying it, please do tag and share your attendance this evening. It's always good for us to kind of see the activity afterwards and for others to see that we have these webinars available for you all as well. So tag us in at Shop Beautiful and at Skin Smile Success. It'd be great to see what you've been up to and what you were doing while you're watching me this evening. That's always good because I'm nosy. Okay, so without further ado, we're going to continue on this evening. So about 45 minutes-ish, depending on any questions that I might have. That's how long you aim to be with me this evening. I've done a very similar webinar to this with regards to acne, but again, we are going to be focusing on, the other types of acne that can occur, as I've mentioned already. So the aims of this evening, how to help our clients with potential acne and or what is going on when it comes to acne. So the objectives from this, I would like you to refresh, as always, on the anatomy of skin. Back to basics, as always, every day is a school day and you might even pick on something new today. I've learned something today. I learn something every day. Explore why acne occurs. So we're going to obviously delve back into that. I know we already know, I'm not teaching you how to suck eggs, but just a refresher. Key acne ingredients and why. Those of you that have done my webinars before will hopefully understand and recognize that Annette doesn't always like to talk about brand specific when we're doing webinars. Sometimes I do, it depends on who I'm doing it for and why. The great thing with Shop Beautiful is we have lots and lots of different brands available, and as a clinician, as a specialist, skin specialist, whatever your background is, you can make an informed decision on the products that you choose to use. So I'm not here to kind of throw products down your throat this evening. It's more an education-based webinar. That's what I like to do. And hopefully by the end of this evening, you'll be able to identify home care and professional considerations that you can make as well moving forward. So hopefully you can all hear me. I'm just going to check, make sure there's no issues. Yeah, just a few people said hello. That's fantastic. Okay. So who am I? My name is Annette Matthews. I am by trade and in past history. So I am a dental hygienist, dental therapist. So I work in dentistry, or I worked in dentistry. I now have my own skin and aesthetic clinic in Wirksworth, Derbyshire in the East Midlands. Now, my relationship with Shop Beautiful came about by accident about 4 years ago when I started working with their other company, which is called MedEffects. And my passion for skin kind of came quite early on from dentistry, because I was working with some clients that were coming in to see me for their teeth and their mouths, but I picked up on things on their skin and I really wanted to help them with that. So I furthered my education and I continue to do so. I'm just in the middle of a master's in cosmetic medicine, skin and aesthetics right now. As I say, I learn something every day. So I'm not here because I know everything. Please don't think that. I am here because I've, got a little bit of experience I want to share with you. I've had things that have worked, things that I haven't, and I absolutely love helping other people, create their businesses and help others with their skin concerns as well. So that's a little bit about me. Based in the East Midlands, this is a picture at Carsington Reservoir. So if you're ever in the Peak District, do come and have a visit here. This is probably one of my favourite cases that I did. And believe it or not, the vast majority of work was done by this young lady herself. And that's something that I really want to portray to you guys this evening. When we are looking at treatment plans, yes, there are professional treatments that we can do and get magnificent results from when it comes to acne. You know, how and why is it occurring? We need to investigate the what, the wheres and the whens. But this was we have done some professional treatments here, but predominantly this was home care alone. But there are some professional treatments that we did as well. So it's, you know, the results that we can have with this type of skin concern. You know, I don't know about you, but I used to stare at teeth and mouths. Now I stare at teeth, mouth, skin, face, everything. I'm a nightmare because there's so many people that I see out and about that I just want to help. And if there's anything you take from this evening, it's a bit more confidence to kind of reach out and talk to those clients about helping them with their skin concern, in particular acne, because it can be so debilitating. This young lady came to me for dermaplaning. So as you can see from that image above, definitely not something that you wanted to dermaplane at that point in time. So I knew I needed to help her with that whole inflammatory process, which we're going to discuss about this evening as well. So yeah, one of my favorite cases I just wanted to share with you guys. So we're going to start with how the skin works. This is an important one. I talk about this every time I start a webinar when we are talking about the skin. The skin is there to protect what's going on underneath. It's there to regulate sensation and heat. It helps control evaporation. That's really, really important. The right amount of moisture underneath the skin will mean that the skin can function in the correct way. So if we have too much evaporation, like enlarged pores, like broken skin when it comes to acne, like inflammation of the follicles, which we're going to come on to a little bit later on, all of these things is going to affect how the skin works, how it's structured, how it functions, okay? So that is then going to have an effect on the storage and synthesis of what's going on underneath the skin. We are obviously going to excrete moisture from out of there as well. The skin is going to help us absorb things if it's in the best condition, which obviously most of the time when clients are coming to see us, it isn't. So how can we help them? Skin that's functioning properly is water resistant, but obviously if we have that lipid barrier that's broken down, if we have broken skin, if there are considerations of things that have maybe upset the follicles and caused problems with acne and the skin, then again, that's going to affect the structure and the function of the overall skin itself. Another one to mention is aesthetics and communication. So I said to you about the impact that we can make on our clients by having and helping them with their skincare concerns. We use our, you know, we talk to people on a daily basis, depending on the job that we do. And what I tend to find is those clients that come to see me with acne concerns are an awful lot, you know, they're more withdrawn, and we can really, really help them come out of themselves when we help with something like acne concerns as well. And when we say connect to our emotions, if we are feeling stressed out about our skin, what other impact do you think that is going to have? It's going to have an impact on the structure and the function of the skin. As we know, hormones are related to certain skin concerns as well. Something called cortisol is produced when we are super stressed and in other situations as well. So the whole complex organ is something that we definitely need to look after, and definitely something that we don't want to consider and take for granted, which a lot of our clients do. They don't treat the skin with enough respect, and or they don't know enough about it. So that's why it's down to us to help them. So anyone that's been on my webinar before will know this is probably one of my favorite slides that I can sit and have on there and waffle about forever and a day. But when we are talking about the skin, it's important to help your client see that as well. So have this in front of them, you know, at that consultation phase when they're coming in and they think that the dermaplaning and that peel that they've booked in for and saved up for is going to be the be all and end all and the answer to their prayers and dreams. We know that it isn't. We know that we need an integrated and a tailored approach to them. We can help them see that by educating them to the science of skin. And that's something that I do quite often. It can overwhelm them at first, but you always tend to get them on board when you do it this way. So I talk to them about the multiple layers of their skin. I talk to them about the products that they're currently using on their skin. You know, the things that they've spent potentially quite a lot of money in Selfridges, Harvey Nicks, whatever it is, wherever it is that they've gone for some of their skincare products and paid a lot of money for that may potentially not be medical grade and or even making a difference, if not making it potentially worse as well. So think about the skin science when you're talking to your clients, in particular when it comes to acne, and help them see the merits of professional treatments and integrated skincare approaches as well. So the top skin concerns I see in my clinic on a daily basis is acne, pigmentation, another big one. And again, that can occur from acne with the post-inflammatory hyperpigmentation that can occur, aging, lines and wrinkles, and skin tone. So when we're thinking about acne, we can probably highlight pretty much all of these bar aging, lines and wrinkles. Actually, now I'm thinking about it in hindsight. So we're thinking about acne. What type of acne have we got that's occurring? Have we got that pigmentation from post-inflammatory hyperpigmentation? Is it because of previous acne that was there? Is it because we have uncontrolled sebaceous acne that keeps occurring around these areas as well? Skin tone, is that affected by hydration? Of course it's going to be a lot of the time. Skin tone, are they referring to their skin tone or are they referring to pigmentation? Is the redness the thing that's getting them down? It may be dry, it may be irritated, they may be producing too much oil, and we're going to see why shortly. And they're doing the polar opposite of what we need to be doing when we're producing too much oil. So they're over exfoliating, which is in effect causing something like rosacea, the dryness, the irritation, that redness. You can get acne rosacea that can occur in those areas as well. So you can see how it's kind of all interlinked. So client might come with one concern, and it's great that we can help them with that, but try and avoid tunnel vision when we are treating our clients, and treat it as a bigger picture is my advice to you. So I'll put it out to the room. I'm not sure how many are listening live, but what are the top acne client mistakes that they make? And this is relation to any kind of acne or skin breakdown or the skin not functioning as it should. If you want to pop that in the chat, please do. I did forget to mention at the beginning, if you have any questions, pop them in the Q&A because I will run over those at the end and hopefully have time to answer them. But what are the top acne mistakes that clients make? Let's see if we can get some of those coming through, because that always makes it a bit more interactive. Perfect. Everybody's saying what I want them to say because it makes my life easier. Perfect. Exfoliation, over exfoliating. Exactly. No SPF. Thank you, Kitty. 100%. Not moisturizing. Yes, we're losing that moisture. Using soap to dry the skin out, 100%. Too harsh of an exfoliator. Not washing brushes, great one there, Sophia, absolutely. Wearing too much makeup, and the types of makeup when they're applying their makeup. Something that I did is linked with a very, very popular makeup clinic close to me. She's very, very good at makeup, and she was fantastic at doing it, but she wasn't obviously putting any pictures of the client's skin on before the makeup. I was in there by accident one day with a niece of mine and saw some of the skin that was going in there for this makeup to go on top of. So I quickly built a relationship with these people because I wanted to help out. So that's how you can think outside the box if you are looking at, partnering up with certain salons and clinics as well. But yeah, you've pretty much hit the nail on the head there. There's quite a few that we've picked up between us. So if you're watching this at home and it's not live, have a little think about the top acne client mistakes that they're making. Do you know what you've just done there? You've just created a load of content as well. So in that chat, what you just said to me, all of those things are worthy of a post, a social media post. You may want to do a focus on acne after this webinar. So you could do a week-long tip or a month-long tip even on helping your clients with acne. And we've just listed quite a few things there that we can talk about when it comes to content and sharing that with our clients in social media and the likes. So yeah, we've got a few on there that you've mentioned. We've got the over exfoliation with the pads. They're an absolute nightmare. I have a lot of clients who use those, or even baby wipes. The kind of pumice style exfoliants as well. What I always say to my clients, actually, if you want to exfoliate, please let me do it. There are certain clients that I would trust with exfoliants that are obviously in better skin condition. There's a massive kind of thing around acne and people assuming that it's dirty, their skin is oily and greasy, they're going to over scrub and scrub their skin. And somebody mentioned it, that is the pH, very, very important fact. And we're going to come on to that a little bit later this evening as well. Somebody else mentioned brushes and somebody else mentioned makeup. So you've literally hit them all on the head there. Fantastic. Baby wipes as well. Big no-no. And obviously picking and squeezing these spots, which can then induce that post-inflammatory hyperpigmentation to occur. So it's really, really important that we help them see this and understand this as well. And we prevent that acne from getting any worse with the likes of SPF and sun protection. You know, it's not the be all and end all. There are other things that we need to consider alongside, but it's a perfect place to start to help prevent any skin damage. You know, we've got skin that is breached, that lipid layer is breached. It's more at threat to external aggressors. So by simply installing, you know, mineral SPF and encouraging SPF, we're onto a winner with something like that. So is acne preventable? In short, no, but we can have these optimum provisions in place to help manage manifestations that we can. The likes of preventing further lipid barrier damage, and some of those things that you mentioned are going to do that. We're going to prevent bacteria formation in the dermis. So I want you to think about the sort of treatments that you would consider for something like this. So you're preventing lipid barrier damage. Somebody already mentioned an SPF, and there are certain SPFs that you can get from Shop Beautiful and other places that contain reparative processes. They're the sort of things that you want to be looking for. Preventing bacteria formation within the dermis as well. So you're looking for bacteriostatic products. We're going to run through a few this evening. What even time is it in it? Just to kind of refresh you in your mind as well. We want to encourage good skin cell turnover and removal of those dead skin cells promptly. We want to do that at the right point. So if, like when that lady came to see me that you saw on the first picture, I'm not going to start cracking straight on with the peels personally on that client. I'm not going to be doing dermaplaning on that client. I'm literally going to be doing this. I'm going to be replacing that lipid barrier and trying to prevent the bacteria formation within the dermis as well. We want to encourage regular controlled sebum production. We're going to chat about that this evening so you understand that hopefully in the best context possible. Controlling and maintaining the skin's pH. Again, we're going to cover that as well. And I've mentioned this already, reducing that pore size and preventing something called transepidermal water loss, which is pretty much like evaporation of the dermis. If you imagine all that moisture and that hydration that we need underneath the skin to keep the skin healthy is secreted out of the skin. We want to prevent that. And we want to aid that sebum regulation. So have a think about the sort of products and treatments and things that you can think about recommending from your experience that you have. And then ask yourself that question, is acne preventable? If we implement all of these, if we're addressing acne in its acute phases, then we may need to hit it a little bit harder. But if we're implementing all of these from an earlier stage, then we are actually going to prevent that acute stage. Dare I say it? Yes, I do, because I have and I do in my clinic on a daily basis. So the pH of the skin is an important one, and somebody's already mentioned this already. The pH of the skin should sit around 4.75 to 5.75. If you think about water, that sits at around about 7 or 8. Soap, even more so, very alkaline at around 8. So remember those clients that come to you and say, no, listen, you can recommend till you're blue in the face. I'm not using any other products than soap because every time I do, I have a flare up. The reason being, their skin that should sit at around about 4.5 is sat at between 7 and 8 because they've only ever used soap. So when they use something different that is pH balancing, it is going to have a negative effect on the skin. So very, very important. We prepare them for the worst. We always say, it might not, but we always say it's going to get worse before it gets better before we implement any acne plan for our clients from experience, okay? You know, in the early days, I used to get countless messages from people saying, oh my goodness, my skin's getting a lot worse. I'd start to doubt myself and think it's something that I've not done properly. But we know now it's the purge, it's the pH of the skin, it's everything doing what it needs to do to restore its function. That very first slide. It isn't acting in that way. So what other things are going to happen before it does? And it's going to go through a process. I tell my clients now, trust the process. I say that a lot. So pH and acne considerations. The other consideration is that acne will grow in an environment with a pH of around about 6 and a 6.5. So if the skin is more alkaline, we are more at risk of acne and an increased amount of bacteria on the skin as well. So it's important to note the different types of acne and make sure you are familiar with those and the sort of clients that you see that are coming through. Understand what is in your remit and if and when you need to refer. Obviously, we're thinking about medical history. We're doing a full skin consultation. What have they tried? What are they trying? Have they tried anything? Are they implementing it every single day? Are they compliant? Are they looking for a quick fix? They're the ones that to have the alarm bells ringing for, because if you educate them to the science of acne concerns, they will understand that sometimes it's going to take a little while to resolve as well. And there may be other things going on that they would need to consider helping out with as well. So compliance is key with any acne client. Something that I've just implemented at my clinic is at least once a month I take on a couple of teenagers who are really, really suffering severely with their acne breakouts as well. And I help them with their concerns. Again, it's something to think about in terms of your indemnity, your insurance, make sure you're insured for it, but it's a great way of giving something back and getting your name out there in terms of referrals and recommendations and reviews as well. So definitely consider that. If you want to check out my Instagram, you can see how I did it. But yeah, it's a really good thing to do. It's very rewarding, but not everybody can do that. I get that. So familiarize yourself with the different types of acne. And again, acting within your remit and making sure you are comfortable and competent and confident in doing so. Don't forget the gents. So if you're putting any posts out there, you know, I'm guilty of it. A lot of the images that I have and that clients are happy to share, they are ladies. It is the women. It's you know, vastly ladies that come and see me for their skin concern. But I want to reach out to the gents as well. And I definitely suggest that you do the same. So acne in particular, follicular acne and acne of, you know, where there are more hair follicles is naturally more common in gentlemen as well. So don't forget to reach out to them when it comes to helping with acne, okay? But this is when it gets important that we recognize acne within our remit and we understand, you know, if there is a referral that needs to be made to a dermatologist, to a GP, if it's completely out of hand. What I would always suggest is obviously acting within your confidence and your competencies. From experience, and this is not me being detrimental to any other profession, that is not my style, but a lot of the time it's the very basics that haven't been covered. So we are back to basics. We're thinking about home care, we're thinking about compliance, we're thinking about certain things that can actually help with their skin concern, as opposed to topical applications of products and medications. And from experience, back to basics always works out well. That said, you know, there are certain cases that I've had that we just can't quite curb it, and sometimes additional help and GP compliance is required as well. So always act within your confidence and your competence. So oil, sebum, we talked about, I promised I was going to talk about this evening. We talk about oily skin. So first faux pas, she doesn't even know what she's doing this evening, that a client may come in with is oily skin, okay? So their concern is oily skin, so they're going to be scrubbing their skin. That oil is produced as a natural protection of our skin. But the other downside of this oil is it is a breeding ground for bacteria and lots of other things that are going on underneath there as well. It's produced in and around the hair follicle, and it's secreted up the hair follicle through the pores onto the surface of the skin. So if you've got somebody that is over scrubbing this oil and or producing too much oil because of the latter, or because they're potentially over scrubbing and or other considerations like hormones, medication, and many other things that are occurring as well, that's when we start to come across a problem, okay? So when we are looking for treatments and solutions, we want to regulate the amount of sebum. It is going to get worse before it gets better. And we want to help decrease the amount of sebum to a certain point. We still need some of that oil and the secretion of it to protect the skin. If we haven't got enough there, the skin will continue to produce it and the bacteria will continue to thrive as well. So really, really important that we help our client understand that. When I implement new acne regimes for my clients, whether it's professional treatments or home care, I always tell them and warn them, you know what, you're going to look in the mirror in a couple of days and you're probably going to find your skin is even greasier than normal, because what I'm doing is regulating it, and it is always potentially, sometimes it doesn't, but we prepare them for the worst. It's going to get worse before it gets better. So they don't lose faith with the products, with the treatments, with everything that it is that I have recommended for them. So obviously we're thinking about oil regulating products as well. Does anybody know of the name of the bacteria that causes acne? Some acne, not all acnes, but the most popular one. In short, I call it P. acne because I don't like to say this on a daily basis, but the P. acne bacteria is gram-positive, means it likes it where it's warm, dark and wet, and it's in anaerobic growth, so it grows underneath within that sebum, as you can imagine, that we've just been talking about as well. And that is involved in that pathogenesis of acne. So let's just focus on the follicle for a few minutes here. So dare we say it that where we get acne predominantly is where there is hair follicles, because what we've just learned, that's where the sebum is produced, and we understand there are lots and lots of little hairs all over the face generally anyway. Where we have more mature hair follicles, we are more at risk of something called folliculitis as well. So it's very important, like I've mentioned to you, that we act within our competency and confidence level. So if we see something that doesn't quite look right, that, you know, potentially we have helped try and treat the area and it's not improving, and patient is compliant, then it's definitely worth considering a potential referral as well. There are certain fungal conditions that can affect, usually around the scalp area as well, and produce another form of acne as well. So it's very important that, again, you are acting within your competency, as I keep mentioning. But something that our gents do, so they will go along, this is, my husband does this even, so he'll shave himself, and he uses, this is absolute nightmare, and I tell him every single time, he uses a hair conditioner to shave his skin. Absolute nightmare. Don't even get me started on it. I've tried to encourage him to use a soft, gentle foaming cleanser. It's not going to work, so it falls on deaf ears. But they shave, they're causing that friction. So, you know, like when we do dermaplaning, we're removing the dead skin off the layers of the skin, removing that mature hair in this case. And then what are we doing? We're applying post-shaving balms. The vast majority will contain some form of alcohol as well. So think about the pH of the skin and what we're doing to the skin. So if we've got a gent that has generally sensitive skin and or poor or little no skin regimen, they're then shaving the skin and then they're applying some post-shaving balms. Some are really thick emollients. You may have seen them on the shelf. Some will obviously, smell nice. So they'll have a lot of perfumes and chemicals in there. Think about what that's doing to the pH of the skin. So when we are looking at potential acne cases, back to basics. Talk to me about your regime. What are you using to shave? What are you using for hair removal? You know, ladies that are potentially plucking hairs that are coming from certain areas where we don't want them, hormone-induced hairs, or just random ones that pop up every now and again. Or how are they removing that and what are they doing afterwards? So it's back to basics when we've got anything like that in front of us, and making sure that we're covering it in that way. So acne versus folliculitis. You can get folliculitis when you damage your hair follicles. You can get acne too. So it's kind of that differentiation between the two. Once damaged, so this hair follicle is damaged, it's easy for these germs to get inside the follicle. Remember where that sebum is produced, it's going to then cause an infection. We've got bacteria that works its way down, slightly different type of bacteria that causes a common site of infection, which is your Staph aureus. And that is generally found on our skin anyway, but once it gets into that area, it starts to cause us a bit of a problem. Other organisms on our skin can also cause an infection as well. And then we also have obviously external bacteria and things that we may be actually physically applying to our skin. If we're touching, feeling, we've got pets and things as well. If we've got these damaged hair follicles, these open hair follicles, and this damage that has potentially occurred. So I don't know if any of you obviously caught the webinar that I did on maskne. So here we go. So you can damage your hair follicles by touching or rubbing the skin frequently, whether that's with products or not. You may have a picker, someone that's obviously always constantly picking at their face as well, that can cause a problem. Wearing tight clothing, and we're talking about other areas of the body now where we tend to see more sebaceous, angry acne is in areas obviously, around the groin, under the armpits. There are cases that I've been treating with certain products as well. So wearing tight clothing and having skin and or clothes or masks rubbing against the skin as well. Then we obviously have shaving that we've just discussed and chemical induced. So I saw a lady just the other day that she'd got some quite nasty spots behind the back of her ear that kept occurring. Again, Annette didn't think, and we were just kind of running through everything, thinking about allergies, thinking about certain things it could be. And then I just suddenly thought, okay, oh, are you applying your perfume to your skin or your clothes? It transpired that she'd brought a new perfume and she was wearing it twice a day and applying it right to the area where these spots were occurring. And they got quite nasty. And obviously that chemical had broken down the skin, it breached that layer, and the products and things had allowed that bacteria to get underneath as well. So just have a moment and think outside the box, making sure you're touching all avenues, covering all avenues when it comes to your client in that consultation phase. Another one that I saw and heard a lot of, and clients were messaging me with during the lockdown, everybody tended to go out and buy a hot tub, right? There was literally hot tubs all over Facebook and Instagram. But this damage can actually occur while you're using a hot tub or a whirlpool. So you've obviously you've got the heat, you've got the chemicals, you've got poorly maintained, obviously hot tubs potentially, and that buildup of bacteria that's within there as well. So usually they'd see a breakout within 12 to 48 hours after using the hot tub. So again, this is something that you may come across clients, you may be treating them for an area on the face and they kind of open up to you about other areas as well. So it's always important to make sure you chat to them about that as well. Again, everybody's reaction to this bacteria, to this damage of the hair follicle, to the damage of the lipid barrier, to the damage of their skin is going to be different depending on what's going on intrinsically. So how healthy they are, if they have a healthy immune system. Somebody who is more immunocompromised because of certain conditions, the likes of diabetes, for an example, their rate of inflammation is always going to be potentially a lot worse as well. So again, we're acting within our competency and our confidence levels, and we are taking medical history and we are making sure that we are addressing infection. At the end of the day, it's a type of infection. So if it is obviously spiraling out of control, we need to make sure that we're getting them into the right avenues for help as well. The main thing is to try and stop doing what's causing that folliculitis and or the acne that is occurring. So we get them to kind of reflect on what potentially could be causing it. Is it the new hot tub? Is it the new perfume? Is it their poor habit and their poor skin regimen? More than likely. Is it that rush? They're not looking after themselves. They're making excuses and saying they don't have time. They're using soap because everything else has that response. And it's how we then communicate with them to help them see in the right way, potentially how what they're doing is actually having an impact as well. So help them stop doing what's causing it. I'm just going to have one drink, bear with me. Hydration as well, really important one to cover. What do we need to look for in acne? These anti-inflammatory ingredients. So key acne ingredients. We need to ensure that they are oil soluble. Why? Because remember, we may have this overproduction of oil and we've got to allow these products to get underneath, deep down and dirty where they need to do what they're going to do. They have to be barrier replacing and or there is some aspect of a barrier replacement in your plan. We also need to consider something that's bacteria static. So it's going to help get underneath, prevent bacteria, and also kill off any bacteria that is underneath there as well. We want to encourage anti-inflammation, so anti-inflammatory products that are going to help calm down the skin and help, the inflammatory process and the healing process start to kick in. We want to, at a certain point, I've kind of put this in order really, encourage that skin cell renewal. So we want to encourage new skin cells to come through, stronger, more robust skin cells. Remember that first slide that I showed you with the spinning skin? That's how we need our skin to be. So we've got to encourage that new skin cells to come through, new healthy skin cells, so it can provide the structure that it needs to provide and function in the way that we need it to. And sebum regulation, again, that's probably one of the last things from experience that you'll tend to find. It depends on, again, on the individual and the products that you're recommending. But when we regulate the sebum, we regulate the amount of oil that's being produced, we are going to be in more control of the skin and its condition as well, because we need the right amount to protect, but we don't want too much to cause detriment to the skin. So this is where we think about AHAs. So again, a refresher, because I know most of you guys, in fact, all of you guys are thinking about this already. You're thinking, okay, yeah, this is how I would address this, Annette. Perfect, that's fantastic. But hopefully you picked up something new this evening. So an AHA you apply as an acid to the skin, and it's there to treat a variety of conditions. An AHA, an example, as you can see on the left, there's a few. They're going to exfoliate the top layer of the skin. They're going to decrease the skin oil production and help regulate it. They're going to reduce bacteria. They're going to decrease hyperpigmentation, and they're going to promote the penetration of other acne medications and or treatments that we're putting on their skin or that they're using at home as well. Okay, so AHAs at concentration of 10% or less are found in over-the-counter treatments for acne. So that's important to consider when you're thinking about skin science and your medical grade options that you can offer them from the likes of Shop Beautiful as well. Higher concentration AHAs, for an example, would be professional peeling treatments. And there are certain peels you can probably think about that maybe contain quite a few of these things that will have an amazing impact on the skin as well. Okay. Bear with me, there we go. So glycolic acid is derived from sugarcane. It's one of the smallest molecular weight acids amongst all the AHAs. It's going to penetrate the skin easily. Various indications such as acne, scarring, melasma, post-inflammatory hyperpigmentation and photoaging. So we need to obviously bottom out what their primary concern is. If it's all of the above, tick, we've already got the product for them, dependent on their skin in the first place. It's bacteriostatic, and it's going to help with that hyperpigmentation formation too. For me, the most important thing, if you've got someone who has active acne, is you need to control the amount of oil that's being produced and rely on a bacteriostatic activity. So that's the sort of product that you need to be looking for. Lactic acid is an AHA that is antibacterial, anti-inflammatory, and again, is going to aid with hyperpigmentation. Derived from fermented milk as well. So this is the peel of, I think this is probably one of the oldest peels around. This was Cleopatra was pictured in a bath of milk, and obviously she kind of cottoned onto it quite early. Maybe didn't smell too good, but she was onto the whole lactic acid protocol there. Mandelic is derived from almonds, so important in terms of allergens to think about with clients. Potentially it is antibacterial, and again it's another one that can aid with hyperpigmentation. Tartaric and ascorbic acid are derived from fermented grapes and or fruits. They are a rich antioxidant, so these are incredible at lightening and brightening the skin as well. So these are sort of products you could look at applying afterwards. So most of my treatment will always follow with a vitamin C serum that I apply to the skin because of that fact. Then we've got our BHA, so our beta hydroxy acids are topically applied in a variety of skin conditions to include acne. So your salicylic acid is going to work to exfoliate the skin, reduce inflammation, decrease skin oil, reduce bacteria, and decrease hyperpigmentation. Promote the penetration of other products. We know how and why a peel works, hopefully. If not, then obviously what the peel is going to do, the acid is going to break down the top layers of the skin, the dead skin that's held together by our keratinocytes, and allow these other products to get underneath and do what they need to do as well. So that's how it promotes the penetration of other products, because we're breaking down the links that hold the skin together in order for it to get down to where it needs to be. Salicylic is derived from white willow bark. It's anti-inflammatory and again, antibacterial. Tropic acid, synthetically derived and pretty much primarily for anti-aging as well. Your citric, your malic, and your AHAs and your BHAs, these are derived from citrus apples, antioxidant and great for anti-aging because of that antioxidant activity. So another way of thinking of antioxidant, not only is it going to lighten and brighten, but it's going to help remove something called a free radical, which is something that's damaging other cells. It goes around, it's a cell that's damaged and it goes around trying to pinch things off another cell. And what an antioxidant will do is go in and remove that so it doesn't continue to damage other cells around it. So antioxidants are important from a skincare point of view and also a systemic point of view as well. Your retinols and your retinoids, not something I would start on straight away. Hopefully you already know this, but they are fantastic for helping encourage skin cell turnover, should only be used on healthy, well-practiced skin, in my opinion. Lots to address before we apply a retinol. And sometimes, do you know what? We don't even need a retinol, generally, from experience. Even though, you know, a lot of clients will want one, sometimes not always needed. So that's, you know, don't kind of fall into that. But there are lots and lots of good retinols out there. Retinol also, obviously vitamin A, you may see it written down as client using it. Again, it's a whole new webinar potentially for us to talk about. Really good to help with pore size, but there are other things that can help with pore size. Great for scarring, and again, great for hyperpigmentation. Zinc. Now, this is something that I absolutely love implementing to both topical treatments. Again, we need to be careful what we're recommending systemically and remember our backgrounds and what we are qualified to recommend. But what we know, if we do a bit of research around zinc, zinc has anti-inflammatory properties. It may help relieve some of the redness and irritation associated with moderate to severe acne. It may even help the appearance of acne scars. Zinc has also been used for other inflammatory skin conditions to include melasma, rosacea, dermatitis, and eczema. Zinc you will get from leafy green vegetables. So there is nothing wrong with advising your client to lead a healthy lifestyle and encourage leafy green vegetables within it. That said, obviously, you know, if we're going down the supplement route, you need to be careful and making sure that you are competent, confident, and qualified to be talking about that. But zinc is a game changer, from my opinion. Both topically applied, there's certain products that you can find with zinc in it, and that reparative SPF that I talked about. And there are obviously certain peels that contain zinc as well. So zinc is a game changer, in my opinion. So yeah, make sure you do your research on that one. So SPF repair daily, somebody mentioned this right at the beginning, an absolute must. UV defense. So we know that UV rays are the primary cause of skin aging and denaturing of the skin. So let's hit this early and educate them from the start, to include gents. Make sure they understand the importance of their SPF. Do you know what? They're shaving their skin every day. They're applying some form of alcohol post-balm with perhaps a factor of 10 SPF in, if we are lucky. And then a lot of gents, and this is a very stereotypical comment, but one that I will make, they work outdoors. A lot of gentlemen do work outdoors, and they have little or no reparative products on their skin. So hence we see a degradation quite quickly when it comes to gentlemen and their skin, from experience. So we're looking for a lipid barrier replacement and or repair of an SPF. We've got that defense that will come from it against central heating and extrinsic temperatures, and obviously the external environment. Obviously not the gents, but we can try tinted to avoid makeup. Somebody mentioned makeup. There are certain tinted SPFs that you can get. And again, look for ones with other reparative factors in to aid that lipid barrier defense, such as zinc, vitamin C, and all of the above as well. So home care, definitely something worth considering. There is conflicting information on hygiene considerations, but it's always one that I implement from day dot. We get them to use a cleanser. We think about something that's going to pH and balance their skin. It could be a potential toner as well. Serum over creams for those that are acne prone. Prevention, SPF, and lipid barrier repair. Weekly masks, something that's going to help them reduce the pore size and or think about themselves and their skin more on a weekly basis. They're applying something that's going to help their skin. Hygiene considerations, I always consider lifestyle choices, medical history, and things with our clients as well. Intrinsic measures, how much are they drinking on a daily basis? Are there things that they can do to help? Is there something going on systemically? I've got a few ladies with polycystic ovaries, endometriosis, and it does impact their skin. So I haven't got the answers for that. Again, I've had clients that have come to me, they didn't know they've got that. We've noticed these spots and boils that are occurring on their skin in certain areas, and I've sent them on for the advice and the help that they needed as well. We are in a prime position to pick up on the likes of polycystic ovaries early. I had a 20-year-old girl just the other day, and rightly or wrongly, I mentioned that it's not quite normal for you to get the hair growth in this area. It's not quite normal for you to get such angry spots when the rest of your skin is really, really good and you are very good at doing what you're doing and what I've told you to do. Referred her on, and she's now seeing a specialist for it. So there are so many things that we can make a difference with. Be careful with supplements. Obviously, make sure you're competent and qualified to do so and recommend these. But diet, we should be encouraging, a good diet anyway. I quite often get my clients to do a diet diary for themselves. So to mark out the sort of things that are potentially making their skin worse. And there are the atypical certain, things that will. I'm not here to kind of discuss all of those this evening, but we know there are certain things that can kick this off, and we can help our client recognize that early. So just kind of throw it out there, make sure you're all still awake. What considerations can you think of to help your client control the amount of bacteria present? So when we're talking about what I've just said, like the lifestyle choices, I have certain things that I always recommend every acne client and, potential client that is concerned with acne. Is there any that you can think of off the top of your heads? Let's see who's awake, if anybody. If not, I will just continue waffling on because I know some of us are, so somebody said, perfect, yes. Washing pillowcases at 60 degrees, 100%. Not removing their makeup properly, clean masks, clean makeup brushes. Yes, loving all of these. Yeah, so the main things that I recommend is not sharing a towel that hangs over somewhere in the bathroom when people are flushing the toilet. So making sure that they have a towel out of a drawer and or a stack of 25p flannels that they have just for themselves. They wash them at 60 degrees, they use it once, it goes in the wash. They're not using the family towel, the bathroom towel that sits in there, a really important one. They have 3 or 4 pillowcases, so they use one side, swap it over for the next night, and then they wash it. And then the same again and repeat, okay? They're washing their makeup brushes. It's something called a Style Pro you can get off Amazon. Amazing little tool that you can actually wash the brushes with and dry them in seconds. I sell them in my clinic, and they are fantastic little presents for those tweens or people that are suffering with acne at any age. What other recommendations do I make? What else has everyone else said? Because Annette's forgotten off the top of her head. Let's have a look what everyone else has said. Not touching the face. Yes, Amanda. Cleaning your mobile phone regularly. So important. Yeah, washing phone screen. Rachel, you've said the same. Clean masks. Yeah, 100%. So maskne, I was finding it was increasing with certain fabric masks if they weren't washing them. Silk ones were really good because it prevented that frictional acne that can occur. But the disposable masks are the better ones that I would advise for those with acne as well. But yes, definitely recently, not so much now, but it depends on what job they do. If they're still wearing a mask, then it's very important they are not just rummaging for one outside the bottom of their handbag. Who's been there? I've been there recently. So yeah, really important to have that conversation with the clients. What was the product called, please, Annette? What cleans your brushes? It's called the Style Pro. I'll pop it in here. Have a little look. It's on my website, but you can get them from most places now. I saw it on Dragon's Den. Incredible little thing. It's like a glass bowl that you put your brushes in, and it washes and dries them in seconds. I think it might be stand corrected, but I think Dental Directory might sell them. I don't know. Don't hold me to that, but have a little look at certain recommendations that you can help your client with, such as that as well. So for me, hygiene with acne, there is conflicting information on this. If you have a look, hygiene is not associated with acne, but from experience with my clients, if we can just tweak this a little bit, they will see a significant difference. Do not pick these spots. Wash the hair frequently as well, and make considerations of the shampoo that they are using. I would always recommend a paraben-free shampoo and something that is obviously, gentle to the skin, because that can, again, break down the skin, allow that bacteria to get in and increase the risk of bacteria and acne. 60-degree towel wash, good skin regimen and SPF daily. Avoid pets on their faces, choosing mineral makeup, if any. Tinted SPF is ideal. Cleaning their brushes, not over exfoliating, and changing masks regularly. I think you guys pretty much covered all of that, which is good. My work here is done. Professional considerations, and this will come after, in my opinion, home care, and all of what we've just mentioned. That should be the first place that we start. And you have a whole catalogue of products available to you at Shop Beautiful that you can have a look through, understand a little bit more about now, because I've gone over the glycolic, the lactic, and all of the other things that we need to be looking for and what you can help your clients with. And then and only then we can consider the likes of chemical peels, microneedling for post-inflammatory hyperpigmentation and dehydrated skin. And of course, light therapy is seeing an increase in growth in that. It's not something that I use routinely in my clinic, but I know I have peers and people around me that are getting fantastic results with it as well. So I have nothing against it. And I think there is some light therapy training on Shop Beautiful that is free, stand corrected, but you can have a little look into that as well if you want to know a little bit more. What can you be doing now to correct? I offer initial virtual skin consultations for clients. I ask them to send me a picture over. I see how I can help them. Usually starting with home care and building the compliance from there. Once they start to use good quality medical grade products and start to get results, the trust is there. So then if you do implement any professional treatments, which we love to do because it makes an even better difference, then the trust is there already. So tutorials on how to understand their new products as well. You can do all that from the comfort of your own clinic and or home and send that on to them. And it's a really great way of doing so. Hopefully this evening you've got some great content that you can utilize and use, you know, acne posts that you can do. All of those comments that you've made in the chat between yourselves is completely relevant stuff that you can be recommending to your clients. You know, when you sat there thinking, what am I going to post today? I've been there earlier. You're thinking, oh, what can I do? What can I post about? I've got a good before and after picture, but what can I say? What can I do? Here lies the answer. Educational content posts are key to our clients to help them encourage and think about how they can improve their skin solution. And obviously on Shop Beautiful, there is free courses available for you to utilize. There's the free helio care one, the light therapy, and loads of others that you can take a look at and start to think about the products that you're going to be recommending if you don't already have a group of them available. Check out our blogs as well. You can share the blogs that are on there. You can share the content that's on there as well, by all means, if it's going to help your clients and you. I've spelt mineral wrong. That needs changing. Those of you who don't know, I am an ambassador for Skin. Skin is a charity. I think we have a webinar for these guys coming up very soon, actually. Check on the Shop Beautiful Instagram. SPF, as we've mentioned, is very important, but we are all in a prime position to help detect the early signs of skin cancer and melanoma. I had one today, actually, on that note. So a lady came in for... I think what she thought was wart removal. It's a wart that she thought was changing. And we had that little conversation. Look, you know, anything that's changed, we don't like the look of it. Because I've done the accreditation, we then send on for a referral just to get it double checked. So we are in a perfect position. Clients will come to see us with these things and we can help detect the early signs of skin cancer and melanoma. So check out this accreditation and or the webinar that's coming up soon on it that will be free on behalf of Shop Beautiful. So I'll have a look if we've got any questions. Thank you for listening, and for those that are partaking in the chat as well. It always makes it more interesting. Let's have a little look. Yes, Style Pro, you got one at Aldi. Fantastic. You get anything at Aldi, can't you? Absolutely, that's good. Let me just chat. I know I had a question in here. Will I be able to watch from the beginning? Yes, Sarah. I think Shop Beautiful will put it on their YouTube channel at some point. I am doing a biorepeal webinar on Wednesday evening, even though obviously we've not talked about brand specific things. I use biorepeal a lot in conditions that we've talked about this evening, and in certain there's other peels that I use as well. But by all means, if you want to join me on Wednesday, the link will be on my Instagram shortly, but it's already on the Shop Beautiful one already. So if you want to register for that, then please do. I always try to differ how I do the biorepeal webinars. So if you've seen one of me before, don't let that put you off. Come and join me anyway. It's always nice to have you there. And we can obviously cover biorepeal as a bit of a case study that I'm going to be chatting with you guys as well. And hopefully you can join me at that point. Thank you very much for all your kind comments as well. That means a lot. It means a lot to me. It really does, especially on a Monday. So thank you for joining me on a Monday when we're literally just scraping through, aren't we, on a Monday? Fantastic. Now, I'm glad you've enjoyed this evening, guys. Thanks again for joining me. If you want to get in touch, reach out on Instagram, Facebook, follow the guys on Shop Beautiful. and make sure you tell others about the opportunity for these free webinars as well. I look forward to seeing you all on Wednesday, hopefully. And thanks again for your time this evening. Take care, guys, and all the best. Tag me in your pictures, your befores and afters. I love to see how you're all getting on as well. It's fantastic. Share the love. Take care, guys. See you soon. Bye.